What's going on, everybody? Tyler Brown here with FutureDDS.
We're on Friday here at FutureDDS.
And today we are going to talk to you all about our experience taking the restorative and perio section of the ADEX CDCA mannequin exam. Let's go.
Let's go. Alright y'all, so if this is your first time to the channel, what Tyler and myself do, we put these videos out to help students get into school as well as show a little bit of their experience going through dental school. So if you haven't already, make sure you hit pause, hit that like button, subscribe button, and that notification bell so you know whenever we post up new content.
So just to give you all a quick brief about what's going on. So as a fourth year dental student, you have to take licensing exams. So I think the major two ones are the REB exam and the CDCA exam. And it all depends on where you're located or where you want to practice within the US. And so we are both taking the CDCA/ADEX exam. And we've already taken the first part. We took the first part back in
August. If you guys remember us talking about the pros and the endo portion.
Exactly.
Long test, but yeah, this is part two.
Part one. Now, like Terrell said, we did part two. And part two is the restorative, so operative, and the perio portion.
All right, y'all, so traditionally, this is a live patient exam in that we have to go out and screen patients through the clinic to find these class 2 and class 3 lesions in order for us to have patients to actually work on for the exam, as well as doing the perio portion. But this year is actually a little bit different because of the pandemic, because of a lot of the shifting things and trying to make this more of a standardized exam. We are actually one of the first classes to have to do it on a mannequin. CDCA, they give us a typodont, or like the fake mouth that we use in class, but what they do is they put teeth that have cavities in it or simulated caries within it, as well as perio portions that have simulated calculus or simulated deprobing areas. So it's a little bit different. You know, some things we don't have to worry about. We don't have to worry about patient management as much, but you know, it is something new. It's a whole lot of different things that are shifting, and you know, it's something we had to get used to.
Right. And so, granted, we did take the mannequin exams, but unfortunately, there are some states that still require you to do the live patient exam. One of those states being Georgia, which is where I'm trying to go back and practice. And so, granted, I took the mannequin exam, but I'm probably gonna have to pay again to take the live patient exam sometime in April. So that sucks, but I mean, you gotta pay to play, I guess. And so, you know, we kind of wanted to give you all a play-by-play about how our day went. I actually went on Friday. Terrell went on Saturday. So how's your test, bro?
Going there about 7 o'clock in the morning, 7:30, get set up. The exam starts at 8 o'clock. Now, this is a very free-form exam. And when I say this, free-form, it's like you can pretty much take as much time as you want to. You know, so I go, I wouldn't say take as much time as you want to, but essentially, if you're doing the 2 fillings and the perio portion, you get 9 hours for the exam. Yeah. And that's from 8 to 5. You know, you obviously have to ration your time out, but whatever you feel like you need to take more time on, you can take pretty much as much time as you can while still be able to finish everything. So I actually went in there about 7:30, got a quick little coffee, some water, and then set up and you know, go through all the paperwork, different things like that. And you know, once you get in there and you start doing it, kind of feels like it's second nature until you get into the tooth and it's like, okay, you know, I got to kind of lock in and figure out exactly what's going on in here. I think my biggest part is, you know, when you're in clinic, you have a radiograph, you have like a very diagnostic representation of what you're going to find once you get into the tooth. And with this, it's kind of like they give you an example, but you know, it's kind of like, okay, like I doubt they made the tooth look exactly like this radiograph, and a lot of them don't. Some of them have lumbar caries, some of them don't. So, you know, I think it was a lot of extra stress for myself. Just kind of like having that anticipation of not knowing what you're going to see once you get into the tooth or once you actually get into the preparation. So I think that was the biggest thing for me. But other than that, man, I think it was just like, it's kind of like just do what you know how to do, and kind of feel your way through the rest of it to an extent. You know what you need to do, but take everything as it comes. And I think that was the biggest thing that helped me get through it.
So I feel like, I'm not gonna lie, I feel like I had a harder time. But I feel like I was the guinea pig, right? So granted, Tyler Brown, so I'm at the first 30, 35, I don't know how many went that first day.
I think like 36, 37.
I was in the first group, and, you know, and so everybody's like, all right, Tyler, go in there and let us know how it is. And so I went in there and I started, we had to work on a number 8 and a number 30. And so I was doing the ML on the number 8. I started off, and granted, number 1, I started using new burrs.
Yeah,
you know?
Oh my.
So this is like a little tip I'm gonna give people. Stick to what you've been doing, right? Because I decided, I've heard that this burr might be better, so I'm just gonna try to use this burr. And so I was working with the new burr, and you might not think that that's like a big difference, but it can be, especially when you talk in regards to the length of the burr, right?
Yep.
So the typical burr that I use is a 330 normal burr that's like 1.5 millimeters. This burr was about 2, I think it's 2, right?
Yeah, it's like 2.2 or something like that. Yeah.
And that it's different, and
That
it's different. It's different, but
that 0.7, it doesn't seem like a lot, but
it adds up for sure. But anyway, did the prep. I'm looking at the prep. Didn't see that many carries, and so this is something that I think a lot of people, especially in that first group, had to deal with. I kind of thought I saw a little bit of pulp, right? And so with that, we were taught to raise your hand, ask for a modification, and in that modification request, you would say, "Can I get a indirect pulp cap?" Right. So thought I saw it, raised my hand, sent the modification out. So I'm sitting there for like 45 minutes, 55 minutes, waiting for my type of dot to come back. And so when Terrell says, you have an open amount of time, that is true. But if you're sending a modification request, you have to keep in mind you're losing almost an hour every time you send that in. And so that's what happened to me. I lost that hour. I'm sweating. I'm looking around. Everybody's like, other people are waiting, but I'm just like, I need to get my prep back. And so, boom, it came back. And they said, your modification request has been denied. And so I was like, oh, whoa. Like, I see the pulp, what's going on? Well, apparently, with regards to the indirect pulp cap, if you touch the pulp and it's hard on the actual tooth, then you do not classify as needing to have an indirect pulp cap. Instead, that's really just, I guess, the tooth structure, and you're not chasing the caries because there's no tug back or anything. It's a hard shell or whatever it may be. So I couldn't do the indirect pulp cap. Granted, this is new information to me. I'm just now learning this. I'm assuming that if I can see the pulp, then I do an indirect pulp cap. But whatever. Wasted an hour. And so I said, you know what? Let me refine my prep. Went in to refine my prep. And then my tooth fractured. I was like, whoa. God. So I am stressed. The fracture happened. I'm like, oh my gosh, I'm about to fail. I'm hurting. I'm sad. This is not the way I wanted to start off my exam.
And this is the 8. This is the first one.
This is the first 2.
Oh, wow.
This isn't even necessarily considered the harder. This is the easier one, right? So the tooth chipped. Boom. I talked to one of the proctors. Super cool about the situation, and I think that everybody kind of realizes that because these are newer teeth, things are gonna happen. And like Terrell said, we're the first batch to do this. And so I said, hey, this tooth chipped. Literally, I wasn't applying extra, nothing. It just fell off. And like I said, it was really cool. We just wrote a note, boom, I finished that restoration, it was all good. Then on the 30 was a little bit difficult as well. And I started off with the ideal prep, the one that they taught us in first year in operative. I started off with that, dropped my box looked good, and I'm sure everybody in dental school knows that when you drop the box and it looks good,
you get that good box,
you are excited. You are excited. Everything just felt good. I'm like, yes, thank you. It felt really good to get that box dropped. But with that being said, I remember we have a teacher, Dr. Arsenal. He basically said, they're not necessarily looking for the ideal prep. It's more so what the prep look clinically. And so made the ideal, and I'm like, this was just too clean. I didn't necessarily see any caries. I didn't see anything. And so with that, I said maybe I should extend this just a little bit more. And once I extended the axial wall a little bit, I started to see a little bit more caries. And I said, okay. So if I had just left it as the ideal prep, I would have been out of luck because I wouldn't have even reached the caries. But anyway, long story short, basically, especially with the restorative portion of the exam, I would say if your prep starts to look non-ideal, but it does look like something that you would see in clinic, i.e. you were chasing caries, doing things like that, that's okay. Don't freak out. Because I talked to a lot of people. I talked to Terrell about it, and it seems like a lot of people, nobody really fell in line with the ideal prep. Granted, it still looked like a class 3 or class 2, whatever it may be, but it looked more clinical than they did the ideal. So just keep that in mind.
And just to add a little extra to that, like, you know, with the burr, changing that burr on the same day, like even making the box, all these little things, it makes such, again, it doesn't seem like that much, but everything's magnified while you're in this test. So it's like, you know,
like
it could be,
sensors are like alerted.
yeah.
Yes.
So like a little slip of the hand where it's like it's not that big of a deal, you know, when you can easily refine it, but like you think that, oh man, I just like your mind just jumps to the worst, honestly, because any little thing could happen to necessarily do that. And you know, I have portions of my teeth that chipped off, had to do the same thing, like call the proctor. But at the end of the day, in my mind, I'm thinking there is literally nothing I could have done differently. You know what I mean? There is nothing I could have done differently and gotten a different result. So at the end of the day, it's like raise your hand, tell exactly what happened, write the note on your comment page, and that's it. You know what I mean? Like you got to go forward with what's going on. And you know, there are some people out there that get the tooth that don't really have that many caries after the ideal prep, you know, or and that was an experience. You know, we had to learn from one of the proctors that like once you get in there, some of the caries might just be within the ideal prep, and that's fine. You don't have to always have to extend. You know, obviously try to take it to the limits of that ideal prep. Don't just leave it as a conservative prep, but take it to the limits of the ideal prep, and then you know you can feel pretty confident, pretty comfortable about where you're going from there. So,
and even with that, make sure you read the manual, right? Because our ideal prep, like when we were doing competencies back in first year, you know, I think on the actual exam, it was like the pulpal floor, for example, it acceptable, which is like the higher grade. It said that it was like it was up to 3.
Up to 4 is like a fail. Like a 4 is a fail, but that's after a modification.
After a 4.
Yeah.
So 3 to 4 was sub.
Acceptable, yeah.
Right. And then like the top tier was below 3 for the pulpal floor to be down, if that makes any sense. But anyway, when we did operative, our restrictions or our guidelines during that were much more narrower, much more strict.
Very conservative.
Exactly.
Very
So
conservative.
just keep that in mind. And another thing, and I don't know who needs to fix this, but I think this is more so a dental school thing right now. We had 1 tooth to practice on.
Look.
And I actually talked to one of my friends. She goes to UNC. She told me they only get 1 tooth to practice on, and I'm like, look,
that's a disservice.
Crazy. And granted, I'm sure the teeth cost a lot of money.
This test costs a lot of money too.
But the test, honestly though, or even give me the option.
Yep,
you know, I'll spend whatever I need to spend to get those reps in. Because what I don't want to do, even though I'm gonna have to do it anyway, I don't want to spend another $1,000, you know, in order to practice. I mean, another $1,000 because I have to retake the test because I wasn't able to practice. I'd much rather spend $100 and get 3 extra teeth or whatever it may be. And that's just my ideal, and I'm sure Terrell, I'm sure a lot of people feel that same way. So I don't know who needs to get it together, but please help us. We need more teeth to practice with.
Nah, seriously, that's
real.
real.
And that's the caries teeth, not the normal ones. The caries teeth.
What I will say is, so first off, it's not anything that we haven't done before. I'll say that. I think I said told you guys something similar when we did the first portion, when we did the pros and the endo portion. It's nothing that we've never done before, or it's something that we've done before. You guys get what I'm saying. So we've done everything that's happening in the test before. It's just another level of stress, you know, having to do certain things similar to asking for a modification, you know, drilling on teeth that we're not used to drilling on, and on top of that, maybe not necessarily having as much practice time in clinic with it being COVID, COVID-19 restrictions, and having a lot more students actually coming back on campus and those lab slots being diminished.
So now let's talk about perio. Weird. Different.
Very different.
Very different. So granted, got through restorative, and now we're at the perio section. And so they give you like a list of teeth that you need to check to see if there's calculus on those teeth, all sub G. And so it's like you would do any type of like scaling root planning. It's pretty typical, but at least in my experience, it was hard to get the calculus off the teeth. And so I'm working. And I guess I missed this part of the lecture that we got with regards to the exam beforehand. But these teeth are kind of like, I want to say brittle.
They're almost soft. It's like, I don't know.
But no, I'm talking about the. Okay, so let me take it back. Yep. I'm doing the scraping. I'm using my like 13, 14, getting the distal aspect of the back aspect of the tooth. Boom, 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 and all of a sudden the molar comes out. the molar comes out. The molar comes out. And I was like, whoa! So literally my molar comes out of my typodont. And I'm like, bro, what is going on? And granted, I wasn't putting an excessive amount of force or anything.
Man.
So once again, I raise my hand, walk up to the proctor. I'm like, hey, I'm scaling and my tooth just came out. He said, okay, this has been, known to happen a couple times. All you can do is put it back in there. And I'm like,
all right.
I didn't know what else to do.
Yeah.
But, apparently, I think I came back, I talked to Terrell about it, and I think you told me that they had mentioned that in one of the lectures beforehand, that, while we're doing the scaling, we should put our finger on the tooth while we're doing the scaling. And granted, this is just one of those things where it was just like, all right, I guess, and like it, I'll give them a pass this time because it's the first time we did this, but that just should not happen. So I don't know how you felt about it, but
I mean, okay, so this is another situation where not all the typodonts are the same, or not all the models are the same. So first off, again, like Tyler said, we need the practice materials. So like we literally didn't even have one opportunity to practice on the type of typodont that we actually had to do on the exam. You know what I mean? So we had to we had a different model typodont, but the model was different as well as the calculus that was on the model was different. So that was something to get adjusted to and to kind of do it. I mean, obviously, pretty much everyone that's taking this exam has done scaling before, so the premise isn't going to change much, but feeling what it's going to feel like and actually understanding, how it's going to be that day of, that's like immeasurably important and valuable.
100%.
And I think that would have even just made people's mind be a lot more at ease, just feeling more confident going into the entire exam, So I think that was one of the biggest things. Honestly, it wasn't. I mean, it's scaling. Again, they give you the locations where there are deep pockets on the typodont, so you would have to search there for carious lesions. I mean, not carious lesions, for calculus, sub-G calculus, and whatnot. So, outside of that, like, it was pretty straightforward. But by the time you get to the perio portion, you've done 2 fillings. You've been there for probably 7 hours. You might have been able to sneak off and just like scurry some food down. Like, literally, this is the end of the battle. So, you're in there and you're just scaling, you're tired. You're just like, you're trying to get through it. So, at this point, man, you're kind of on autopilot, but you're just trying to stay as focused as possible, and just get it done, honestly, at this point. So, I didn't really necessarily have a negative experience about it, but I think that the biggest thing is making sure if you can, try to find some way to get your hands on one of those typodonts, just so you can see what it's like, just so you can see what the calculus feels like. It's not the same as calculus in the mouth for all the dental students about to take it. It doesn't feel the same. And I think that's something that they plan on changing in the future as well. That's rumored to be changed soon. So,
and our school, I guess our e-board, they gave us some type of like, what is it? The drops.
Yeah, so it's a different type of.
That we were able to put on tooth and kind of practice on teeth, but that was.
It's a different material. It's a different material, different type of dont. Everything's kind of the same. So, from my experiences, just getting in there, and it's like one of the biggest things they said was make sure that you don't gouge too hard because the tooth will start to feel rough. But honestly, when I went in there with the pigtail, the tooth felt pretty rough to me anyway.
Regardless.
So it's like,
hopefully that wasn't calculus.
Yeah, I'm like, I go in there, I feel no. So I went in there, I felt the roughness, and I'm like, in a real tooth, even if there's not radiographic calculus, if you have a deep pocket, like you plane it, you get the cementum off. So I'm like, maybe this is representing cementum. So you know what? I scaled it till it felt smooth at the pigtail, and that's it. Like, again, you do what you know to do clinically, and then hopefully it fits into the parameters of what they're looking for the test, because at the end of the day, everything we're doing this year is new, and we don't know exactly what we want, what they want. So at the end of the day, I feel like, and Tyler, I'm sure Tyler feels the same way, I feel like we performed to the best of our ability. We've done what we know how to do in dental school. We've done in past plenty of times. So outside of that, unless there was some extraneous variable that like caused us to fail, whatever it is, like, I think that both of us and pretty much everyone that we've seen going into it has been a lot more prepared than we believe, and the product that we've been able to put into play has been, a lot better than we think. It's just us being in it, we just always are going to be self-conscious and our biggest critics. So
Yeah.
take that into it, going with confidence. Don't take any of this as negative or as like you'll fail or it's going to be this time this much harder. This is literally just advice. This is literally little tips and tricks or feedback that we felt could help someone in the future, and that's why we're trying to give it to you guys. So
Of course. And if you all have any questions, please feel free to shoot us a DM or ask us in the comment section below so that everybody can see it. We wish that we had somebody to ask questions to,
Man.
especially the student, beforehand. So, of course, we're always here for you all. But yeah, let us know what you need to know, and we'll be there for you. So until next time, see y'all later.